Well, there's no easy way to say it except for the fact that women and children are likely to go hungry. Programs like WIC and SNAP are running out of federal funds. And if the shutdown continues into November, millions of families are going to lose access to food and essential nutrition supports.
Hey there. Thanks for joining us on Policy for the People. I'm Juan Carlos Ordonez with the Oregon Center for Public Policy. And as we're recording this, we're entering the fourth week of the federal government shutdown. And the longer the shutdown goes on, the greater the risk that people in our country will start going hungry as federal nutrition programs begin to run out of money, according to today's guest, Elaine Bigelow. Elaine is the executive director of the Georgetown Center for Poverty and Inequality. Earlier today, I spoke with Elaine about what's at stake in the federal government shutdown, what the massive tax and budget bill enacted by Congress in July means for the economic well-being of the people of this country, especially women and children, and what it would take for a country to seriously confront poverty and economic insecurity. Here's my conversation with Elaine Bigelow. Hi, Elaine. Welcome to Policy for the People.
Hi, Juan Carlos. It's great to be here.
So, Elaine, why don't we start by you sharing a little bit about the Georgetown Center on Poverty and Inequality? What does the center do? What's your mission?
Yeah. Thanks for that question. I think it really sets the stage for the conversation. So the Georgetown Center on Poverty and Inequality was started by Peter Edelman, who is an icon in the poverty space, both for his work and his teaching on poverty. He famously resigned from the Clinton administration in protest after the passage of the so-called welfare reform bill in 1996. But his legacy started long before that when he worked for Robert F. Kennedy Sr. So maybe more people are familiar with Jr. right now. So I think it's important to take a minute to talk about Robert F. Kennedy Sr.
It's not the same person.
Yeah, not the same person at all. For me, and one of the most important things that I remember about Robert F. Kennedy is that he ran for president, and a central part of his campaign was to eliminate poverty. And I think that is shocking when you think about presidential campaigns nowadays, because the word poverty is just not on the top 10 list of words that people use. And shortly after he announced, he gave a speech in Kansas where he told students that they could heal this country by ending the disgrace of poverty and hunger among their fellow citizens. So RFK was unfortunately assassinated in California not long after that. And the healing he spoke about never had a chance to be realized. And so over 50 years later, I believe that the sentiment he talked about is still true. And it's why I'm honored to be leading the organization today.
So right now, as we're speaking, we're a few weeks into the federal government shutdown. What's your bottom line assessment as to what's at stake in this federal shutdown, especially as it relates to the economic well-being of women and children, a topic that you've written about before?
Yeah, well, there's no easy way to say it except for the fact that women and children are likely to go hungry. Programs like WIC and SNAP are running out of federal funds. And if the shutdown continues into November, millions of families are going to lose access to food and essential nutrition supports. So WIC, which is a program that serves new mothers, pregnant women, infants, and young children. WIC alone serves 7 million pregnant women, new mothers, infants, and young children each month. And this program is set up specifically to provide health, nutrition, and long-term development at a critical time when new mothers, infants, and young children need it. It's not a nice to have program. It is core to healthy child development. And more than 60% of SNAP recipients are women and children. So that's roughly 26 million people who could lose access to food within weeks if the impasse continues. Maybe if you're kind of a cruel person, you might think that this is okay because it's just a few weeks, but this is really about long-term well-being. Interrupting nutrition and health supports during pregnancy and early childhood has lifelong impacts on health, education, and future earnings. So this isn't just a short-term problem. It's about a long-term impact and cost that we will have in our country.
So I want to step back and take a look at the big picture as it relates to poverty and economic insecurity. Where would you say we are now, and where have we been when it comes to poverty and economic security in our nation? Have we seen progress? Have we gone backward? Where would you say we are?
When I think about where we've been, I think for decades we've told this familiar American story that success comes down to hard work and personal responsibility, and that you have to pull yourself up by your bootstraps. But that story ignores the structures that determine who even has boots. Things like access to good schools, affordable housing, childcare, and healthcare. And that story has fed our policy decisions. And when you think about the 1970s and the policies around helping people and tax cuts, they started to change, where we saw a lot of our legislation rewarding wealth over work, tax cuts for the top, deregulation, weakened labor protections, and declining public investment in the services that people rely on. And so, for lack of a better word, the safety net became harder to access, more stigmatized, while costs in every part of life, like basics, like housing, food, kept rising. So to me, we are currently in the mess of those decisions and that storyline. Even with low unemployment and rising wages, families across income levels feel squeezed. I mean, we have heard politicians and the news and the media talk about an affordability crisis because people feel like they're working very hard, but it's not getting them anywhere. And policymakers can't control global supply shocks, but they can control housing, childcare, and healthcare costs. And that shows to me that these aren't personal failures, they're structural policy failures. And we can't keep telling ourselves that false story because that isn't going to solve the problem. So again, I think what all of this means is that when we think about how many people are in poverty now, which are probably over 36 million people, the numbers reflect policy decisions that make life harder for working families and easier for those already at top.
Speaking of policy decisions, in July, the Republican majority in Congress passed a massive tax and budget bill, H.R. 1. Some call it the One Big Beautiful Bill. And this legislation has set in motion massive changes to the main ways our nation addresses poverty. Can you talk about what this legislation means for the economic security and well-being of the people of this country, and especially women and children?
Yeah. I think one of the most important things to know about this bill is that it is a huge transfer of resources upward, away from families who rely on public benefit programs and towards a group of people who make over $500,000 or more. So we are seeing cuts to nearly $1 trillion from Medicaid and $187 billion from SNAP, and wealthy people are going to get $3.4 trillion in tax cuts. So I don't really think you have seen that scale of wealth transfer ever in the U.S. And when we look more closely at who is affected, GCPI did an analysis, and it showed that about 2 million women would face new SNAP work requirements, and 6 million women on Medicaid could lose coverage. And the way that they're getting all of this cost savings is by imposing what's called work requirements. And work requirements might sound super common sense, but in actuality, they are just a compliance test, a paperwork burden to just cut people off the rolls. And it's really important to know that a lot of these people who are affected are already working, but they are in really low quality jobs. They aren't getting enough hours, and they don't have a lot of stability. So this legislation shifts the burden from trying to address the real barriers of of what people are facing, which is under predictable hours, lack of childcare, and jobs without stability, into a compliance test. And maybe you might think, well, let's just see what happens. We'll see if this works. I can tell you that states have already tried it. And in Arkansas, we saw 8,000 people lost Medicaid coverage with no increase in employment. So from a just policy objective standpoint, it's a really bad policy if you're looking to actually get people to get to work more.
Another thing that the Republican tax and budget bill does is it shifts costs to states like Oregon, costs for Medicaid in particular. So at the same time that we're seeing this cost shift, so greater costs for states, and we're seeing people lose Medicaid because of things like work requirements, they're going to be losing access to Supplemental Nutrition Assistance Program, SNAP. So there's both greater need and greater cost to the state at the same time. So it's, in essence, we're faced here in Oregon and in many other states, in all other states, with like a double whammy of increased costs and greater need. So what would your advice be to state lawmakers given this situation, and keeping in mind that states cannot run a deficit? We have to keep a balanced budget. So what would your advice be to state lawmakers?
Yeah, it's so tough. And if you have friends that are state workers, I would say reach out to them. They must be having such a tough time right now because they're in an impossible situation. They're facing a crisis on two fronts, juggling, again, the government shutdown, where currently they are running out of funding in a couple of weeks. And at the same time, they are trying to figure out how to manage the impacts of OBA, the One Big Beautiful Bill Act, HR 1. And it's hard because the legislation has put forth sort of these exceptional considerations in order for states to be able to get the same amount of funding, essentially. And we actually did a really great map. If you go to our website, it has a really neat feature where you can go over each state and see how much the cost shift will be to each state. And in Oregon, the SNAP share for the state would jump from 158 million to over 476 million. That's a 202% increase for SNAP just alone. And the things that they will need to focus on are something that's called error rates. And Republicans use this as a talking point, really making it seem like states or people were committing like a lot of fraud in the system. But error rates, I think it's important to note, aren't just about fraud or overpayments. They also include when a state underpays or doesn't deliver benefits that people are eligible for. So a high error rate can also mean that the system is just stretched too thin and that families are not doing anything wrong. So some of the things that states are probably looking at doing is bringing those error rates down, trying to improve their accuracy rates. In that way, they're probably looking at technology to develop so that determinations for eligibility and approvals can run through a more efficient system. But all of that takes time and money. And I don't know if there's a lot of extra time and money going around these days. So to me, this is really an exercise in futility at some level, because this really should be a program that is funded at the federal level the way it has been, and should be expanded rather than have states sort of jump through a bunch of hoops and people, lose benefits.
So why don't we switch gears here and talk about sort of looking forward and what can be done given this scenario. And I'm wondering what you think it would take for the nation to seriously confront poverty and economic insecurity. What would that look like if we really decided to tackle the struggles that family face and try to really improve the lives of people?
We have to reject the myth that poverty reflects personal failure. We talked a little bit about this earlier, and, you know, the situation that we are in reflects government priorities. When we invest in families and communities, poverty fails every single time. You might have heard of, a very common example most recently is the expansion of the child tax credit. When we expanded the child tax credit, child poverty was cut nearly in half. And when the child tax credit expansion expired, poverty rose again. So that is a direct correlation, a cause and effect that you often don't get a chance to see, but you can really see in the child tax credit policy. But it's more than just that. When you think about housing, housing is one of the most powerful drivers of economic wealth and stability. Yet we don't have a national housing policy to make more people homeowners in this country. That's decades of evidence that we already have at our disposal. We already know what works. We just need to be able to make the choices in our policies to that value work, care, and stability and security for all families. So poverty will shrink when we build an inclusive economy, and we make opportunity the floor, not the exception.
What else would it take to create, to build an inclusive economy? You talked about a more robust child tax credit, investment in housing. I'm wondering if there are other policies that you would put towards the top of the list, towards the top of priorities.
Yeah. So, having some, like the child tax credit, I think is a great example. It's, at some ways I sometimes break it down to just cash as well. So there's lots of versions of cash that we can give people to help make them to give ends meet. Another policy that I think is really important is care. So I think that is manifested in two other policies, which is childcare and paid leave. I've worked a lot on paid leave in my career, and people don't often understand how important it is in someone's life, both when they might be having a child or caring for themselves if they have a cancer diagnosis or caring for an elderly parent. Those life situations often interrupt jobs, put people in a financially unstable place, and sometimes can be a big part of whether or not they can recover from their own illness or add years to their parents' lives by taking care of them. And so these are things that happen to almost everyone all over the country, that essentially we tell people, like, if something bad happens in your life or even something great happens in your life, you have a child, you just need to figure it out. You have to take unpaid leave, paid leave. If you're very lucky, you're probably in the upper echelons of, workers. But for those who are struggling, living paycheck to paycheck, trying to figure out how to keep a roof over their head, like, you either have to quit your job or take unpaid leave. And that, to me, if you can bring stability in somebody's life through paid leave, you're really giving them a lot more to work with.
I wonder if you have some thoughts as to what can be done at the state level to address poverty and economic insecurity.
Yeah, so I'm very interested in seeing how some of the initiatives that Governor Phil Murphy in New Jersey has done, how that will bear out over time. I know there's a big election there this year, but he's done some pretty, I think, amazing things to watch out for. He recently signed landmark affordable housing legislation. And I think housing is fundamental when you're talking about poverty. They have a Cover All Kids initiative, which ensures that every child in the state, regardless of immigration status, has access to health coverage. He's invested over $1 billion in childcare. They've had a long-running paid leave policy. He's accelerated the rollout of the child tax credit. So those are all the types of policies that you would want to really see on the federal level to help people build thriving lives. So housing, paid leave, childcare, healthcare. So those are the types of supports that I'd like to see on the federal level, that I'm sort of watching what's happening in New Jersey and hoping that there's enough time to watch that stuff bear out and getting the evidence and data from there.
And I should mention for the listeners that Oregon, and we should be proud of this, we enacted our first child tax credit a couple of years ago. We also have a Cover All Kids legislation as well, and compared to most other states, a pretty good paid leave legislation. So go Oregon.
Yes. Yes, very, very close. I will say, I was thinking about using Oregon also as an example, but I thought it might be too much on the nose. So
no, it's good to hear what other states are doing. That some policies are common sense, and that other states should move forward on them as well. I'm wondering, you've mentioned a number of policies that are effective. You also said before that we kind of know what needs to be done to address poverty and economic insecurity. So given that we know what needs to be done, what do you think is holding us back in terms of making the right decisions, in terms of, especially at the federal level, but certainly at the state level as well, to really moving forward with the kinds of things that need to be done?
Yeah, we do know it works. We have the evidence and the lived experience. It's all there. And I think what's holding us back is the political will and narrative. And, it sort of takes me back to what we started out our conversation is, Robert F. Kennedy Sr. and his campaign to eliminate poverty. And as a presidential campaign, we have not seen that in a very long time. And we do need at a national level someone to be changing the public conversation. And, we are sort of going in the opposite direction. And the mindset that blames people blames people in poverty for where they're at rather than understanding the system that produces it is not helpful. We've had so many conversations over the recent years about racism and sexism. They're still there, and they are holding people back. When you think about the work requirements and the paperwork, that's all designed to police poor women, especially women of color, and that history still shapes how we talk about deservingness in this country. It's also really important to talk about how when large swaths of the population feel locked out of opportunity, they lose faith in the idea that our system works for them. And that erodes civic participation. It creates political instability. And we no longer have a shared purpose. So those are the things that I think about when I'm like, what will it take to make the right policy choices? We have certainly a long way to go, but I think poverty is only going to end when our policy choices reflect the belief that everyone deserves stability, dignity, and opportunity.
And Elaine, for people who do want to see our nation confront poverty and economic insecurity, what advice do you have for them? What actions can they take?
Yeah, I think it's really important even now to listen and talk to people. I think for lots of reasons, COVID, technology, I feel like we aren't talking to the same people that we were talking to 20 years ago, 30 years ago, even 40 years ago. And I know that's what I have been trying to do in my own life is like talk to people who I wouldn't normally talk to and really listen, hear where they're coming from and try to find common ground. I think that is the tough path forward that we have for this country. I would love to say that like something big is going to happen and we'd swing in one particular direction, but I think it's going to take hard work of people talking and listening to each other.
Well, Elaine, thank you so much for being on our show.
Yeah, thank you for having me. I really appreciate it. Love the questions and looking forward to chatting another time.